So, respected friends, thank you so much for your kind participation. Let's start today's session with an invocation of a song. So let me just share the screen. Thank you so much for your kind attention. Uh, Dear and respected friends, today is our second day of our international summer school, and this school is being nurtured by Vishwaneedam Center for Inclusion, um, Government Art College, City College, Karnataka, Hassan, and OKAYMINDS. It is a social enterprise to promote mental health awareness and well-being. Uh, so, on behalf of the Vishwaneedam Center for Inclusion, we welcome all of you. Uh, we welcome today's guest and honorable speaker, Dr. Nimisha Vandan. He is co-founder of OKAYMINDS. Uh, Let me also give a kind of brief speech of her work. Dr. Nimisha Vandan is a co-founder of OKAYMINDS. It is one of our nurturers of International Summer School. Dr. Nimisha Vandan is a former postdoctoral fellow at the School of Public Health, the University of Hong Kong. He was part of the global research team that is researching the impact of COVID-19 on public health in Canada, the United Kingdom, China, and Hong Kong. She recently published her PhD on experience with Hong Kong healthcare system from the University of Hong Kong. She has completed her master's in international health from the University of Tokyo, Japan, and published several research papers and articles in various national, international peer-reviewed journals. She has been actively engaged in various projects related to mental health and well-being. She is certified to conduct mental health first aid and carries certification in mental health literacy. Uh, so on behalf of Vishwaneedam Center for Excellence, welcome her. So, dear and respected participants, uh, the senior citizen from the most vulnerable section of our society, especially they are living on their own. They are the ones who tend to neglect their health when they required that the most. Unfortunately, the concept of providing preventive health care is not very popular in India and also some South Asian countries, particularly due to ignorance and partly due to the feeling that it's not so important in the sense of, the creation of joint family and all modern cultures. But in this summer school, we are trying to understand their problems, challenges, and solutions. And I think this is also one of the important aspects of our personality development. And we need to inculcate a kind of sensitivity towards vulnerable section of the society. We have to also care for our parents. We need to learn such life care management skill, I would say. And we can become our caregiver, care uh, uh, life management skill is very important in that sense. So, without further ado, now I would like to invite Dr. Nimisha ji to kindly give today's presentation. And all of you are requested to please be active You must ask some questions. Let's have some interactive session. It is not like one way. It is not webinar. So please ask your question fearless. Thank you, Manisha
Thank you,
ji.
Doctor. Thank you, Dr. Gautam. It's a pleasure to be here and listen some of the participants, and they told about their introduction about their education and their aspiration. I'm so happy that our youth are thinking in this direction and doing studies and trying to learn more about elderly mental health or geriatric care, or you can name whatever you want. But before we go further and learn more about today's topic about geriatric care, I would request the participants to, as Dr. Gautam also mentioned, that we need to actively participate in this session. So the more we talk, okay, you can interrupt me at any point of time. Just by you have any questions, doubt, or any sharing, just do it at any point of time. And the more you will interact, the more learning will be there. And the intention of this summer school is not to deliver just talks and seminar and some of the participants just being listen, but the more takeaway you will do, the more questioning you will do, the more thinking you will do, and the more discussion or brainstorming we all together do, the learning will be better, and the leveraging of this kind of summer school will be at its peak. So it's better that whenever is necessary, you just ask question, you just share. If you have anything to share at any point, which we are discussing, any kind of experience or challenges or anything you want to share at this platform, please do so at any point of time. Okay, it's not a lecture, it's just interaction session. More and more talking will be more welcome. So let me share my screen, and then let's keep on talking more and more and try to understand each other's point of view on different perspective. So the way we are going today is like Dr. Gautam also mentioned, and some of the participants mentioned about the role of elderly in our society, and also the role of healthcare, as we saw the video yesterday's lecture was about the healthcare perspective. Today also we are going to talk about a care perspective, not only related to health but also in different dimensions. For example, how sociological, psychological, or financial aspects, or just their health aspects in different dimensions of the society are going to influence an elderly. So if you see the simple thing, uh, like we born as a child, right, a small baby, and then toddler, and then become the child, then adolescents, and then adults, then older adults, and elderly, and then that is the end of our life, right? So we all are being adult. See the phase we all are in nowadays, we are in most of the adult, right? And this adulthood has a responsibility of 3 generations, uh, younger to you, or your children, or your whoever is younger to you, your own generation, your own spouse, friends, peers, and then elderly, your parents, your any community member, or if you are a caretaker, if you are caregiver or care provider, or working in, say for example, nursing home, or any such kind of place where uh, you have to interact with elderly, or just your family member or relatives, then you have a responsibility and role towards the elders also. So this whatever we are going to learn, let's try to take this learning and try to implement, not only for elderly but also for yourself and your age, and also you can use it for a younger population. But today's, as we say, that we are more focusing on the elderly, and then let's try to see how best we can use this knowledge to support our older adults, say for example our parents. So Today's topic is more about empathy. So if we want to simply say what empathy is and what different concepts of empathy we are going to learn, but before we go into that section, we will first try to understand that once we grow old, right, then there are some kind of decline you can see in your parents. Let's take example of your parents, because not, if you're not your parent, then take example of your grandparents. Let me tell you my own experience, that just few years back, it was a just few years back, it was very easy. It was very easy for me to see my parents actively doing different household chores or their office work, their other kind of responsibility and duty. Just few years, and gradually I'm seeing the decline. In last few years, my father passed away, and my mother, I see her changing day by day. How her physical, psychological, emotional, and financial, from each and every aspect, she is declining. You can see how the health is declining, how her responses are declining, how her cognitive abilities are declining. So, like, for me, seeing my mother as a super active lady to slowly declining in her activity, in her thinking power, in her responding power, everything, it's a big challenge for me. How best, as the caretaker or as a child of my mother, how best I can support her. So likewise, if someone is working in the, say, vridhashram, like elderly homes or hospitals or hospice care or any kind of care or centers where you are supposed to interact with elderly, then there are chances you see the decline. And once we try to analyze these decline, you can see that decline at individual level. The first decline you can see at individual level. Maybe they have some acute illnesses, sudden cardiac arrest, for example, or they need to get hospitalization quite often. They will have some kind of disease, for example, chronic disease, hypertension, diabetes, to name a few. And it's very common that now elderly more have comorbidity, like together they are suffering from many diseases. Like if there is heart condition, chances are high that they are suffering from some kind of and like, for example, obesity or diabetes or anything like that. Hypertension, these are very common illness. If not like there are some cancer, or there are many diseases which elderly suffer. Once you see in the elderly some kind of chronic diseases which is physical health related, then chances are very high that they are suffering from some kind of emotional turmoil also, or emotional health concerns. For example, if they are suffering from, say, cardiac heart disease, or they having some kind of pulmonary disorders, or kind of any obesity related disease, then you will find that somehow their mental health or emotional health is also impacted, and they may be suffering from either depression or anxiety or any such kind of emotional turmoil or disturbances. For example, now you see, for my mother, let's take her example. She had some intestine related problem, and somehow she was also diagnosed as being depressed. So first it was only physical, then gradually it comes to her mental illness also. Now she is taking medication for physical illness as well as mental illness. And when I tried to see that what is the relation, like the person when he or she is suffering from physical illness, why it is coming to the emotional illness or mental illness also? Because body and mind is linked. It's an integrated system. So whenever there's a one part, like for example, we in Hindi we say jaisa tan vaisa man. So if you have some problem in your body, definitely it's going to impact your mental health or emotional well-being. And once there is some problem in your mental health condition, for example, your cognitive ability, your emotional disturbances, or stress, anxiety, or anything related to that, then it will come to your body. for example, if you are tensed or stressed or anxious about something or worried about something, just for a few hours, you will start feeling headache. That is the first symptom that how your mental health condition is directly connected to your physical health condition is directly related to your mental health condition. And once the elderly are suffering from any kind of chronic disease, then it is reflecting in their emotional well-being. Then there are some structural issues. For example, a staircase, they fall from there, or in the toilet. If that is like a Asian style of toilet, is squatting way, that is very dangerous for them. Or sometimes bed fall injury, they fall from the bed and get leg broken or hand broken or something like that. So these kind of things are very disturbing. Then there are some more challenges related to financial, because they either they retire from their job, or they are not able to do the job now. Then there are a big, and most of the elderly, if they are on some social welfare or pension scheme, then their income suddenly drop. Not only the work, but also the income drops. And then once they have reached to the phase of elderly or the older adulthood, you can imagine they have crossed and they have fulfilled most of their responsibilities: education of their children, then marriage of their children, then taking care of grandchildren. All these takes money, their home, and their other financial responsibilities. Then at the end, during this golden period of their older adulthood or elderly period, financial challenges comes up a lot. Let's take one more example of their individual trouble, which triggers their decline, is health related literacy or understanding. Because for many of the disease, they were solely rely on their healthcare professionals, doctors or nurses or whoever they are going for accessing the healthcare. Then they don't have that much of knowledge or understanding about their own health. Either they are very busy, or they have prioritized their health as a very low, or they don't have those kind of access to the knowledge or information which they can use. So because of this reason also, they are not able to keep up their health status in a more sound way. Then there are home management challenges. If they as soon as they grow older, they have some responsibility at their home, and if they are not able to take care of their home cleanliness, this, that, then that creates a lot of problem in their life. Then mental and behavioral health and physical limitations, all these. Then access to food and nutrition, that is also a well-known problem. And poverty is known as one of the most disastrous situation among the adults, among the elderly, that because of poverty they are not able to do anything, and stuck with the family and community. They have to rely on their family and community to take care of them. So there and then that creates a lot of other issues that related to the system and society, the sociological problems, the abuse problem, and then they rely on their either their children or any caretaker. Then the relationship with the caretaker, what kind of relationship caretaker is doing, then is there any abuse, is there any ignorance, negligence, all those things are there. And once they reach to the system, then they, if they are hospitalized, what kind of after hospital care or community care is available, then how they are going to do the transportation to reach to the hospital if need be, or any healthcare services if they are utilizing. And then what kind of resource allocation is there in the system for the elderly. Especially you see during the COVID time, many of the hospice care, elderly care homes, all were closed. And elderly were the most vulnerable population in our society. They had no place to go, no socialization, and the social isolation make them more vulnerable. So you see that how different degree, different level of things, starting from individual to family and community to system and society, all triggers their decline of activity and responsibility and the responding ability for different situations. Then if you generally, like, we name few more disease about which impacts elderly health problems. Let's see the more disease you all know, but I would like to take your attention to heart disease are very common, then memory, okay, dementia, and those other kinds of disease. Then there are gallstone, obesity, emotional, anemia, cancer, high blood pressure, diabetes, osteoporosis, any disease related to their bones because of lack of calcium or deficiency of calcium, that is like cause osteoporosis and osteoarthritis. Those are disease mostly in female but also in male. And then eye disease, or their visual power, then other cognitive abilities, all those get impacted. So these are the some disease you can see at the physical level. But once they have these kind of disease at the physical level, this all will turn and create a big impact on their emotional or mental health and well-being also. So see, let's see one thing. Once they have being say being elderly, once they are declining in their activity, then for example, take my mother's example, then she has less mobility, limited mobility because of her arthritis issue. She cannot walk much, or she is not able to go to her friend's place or any community service or anything. So this limited mobility, and also she is having eye issue, not clear vision. Because of that, her mobility is very restricted. And because of the restricted mobility, loss of physical fitness. Okay, because there is no physical activity, then her appetite and other things, like she is getting obese and not active, active in walking or no other activity. So that is, her physical fitness is also reducing. And as she has limited mobility, she's not able to go and meet friends, so there is social isolation. And because of this, there are increased risk of getting any kind of disease. Physical activities and social isolation creates a lot of feeling of loneliness, isolation, those kind of things. And these creates, once they are at increased risk of any kind of disease, then fear is always in their mind. What happened if I get this disease? What happened if something wrong happened to me? Who is there to take care of me? Something like that. Then you see the limited activity again leads to limited mobility. So this is a vicious cycle, which starts from physical taking to the mental, and then it is an integrated cycle of physical and mental health. Both are getting impacted. So this research with the Mental Health Foundation, this said that there are few, the concepts which and the factors, mainly these 5 key factors that affect the mental health and well-being of older people. Starting from discrimination. Why discrimination? Most of the time, aging is known as a discrimination thing, because elderly or the aged population, um, eh, you see the grandchildren have their own preferences, then adults have their own preferences, and uh, then their own society have different kind of discrimination. For example, Indian community, if you see that, then you can see it, aging itself is a very very stigmatized thing. uh, People don't want to say that I am of this age, just for a different purpose. But see, with the aging society, they become of different generation. And then you can also have the name generation gap, this and that, create a lot of confusion and separation and isolation from their own children and their other family members. So discrimination is a big thing which is impacting their mental health. Then participation in meaningful activities, as we saw that there is limited mobility, limited activity, uh, or any other cognitive abilities. Because of that, their participation in different kind of meaningful activities, for example, they were volunteering at the temple or the church or different other places, or work in the NGO or any other things, or their own work, their own job, whatever they are doing, now no more is there. So those kind of meaningful activities are very restricted or stopped, and that becomes the factor affect their mental health. All these comes to the relationship also. So you see that uh, money plays a big role in this situation, because the time they were earning, the relationships with their peers, with their parents, with their other relatives were different. But as soon as that is stopped, and they become dependent, kind of dependent on their own family members, for example their son or daughter, or other caretakers, then the relationships change. And that kind of relationship is somehow starting creating a lot of disturbances and influencing their mental health and well-being. Poverty, once they are on their pension, or sometimes they don't have any money, then they are, some are their social welfare or any other community welfare, or on pension, or any other means dependent on their family members. Physical health, as we all know that physical health, because with the aging a lot of comorbidity catches. And these all five factors are very important when we see how the elderlies are getting impact, not only the physical health, but related to that, the mental health, the financial health, the relationship. So all the sociological, socio-psychological, socio-economical, all those factors are impacting our elderly mental health and well-being. So the first picture is of China. So I'm not talking only about the India, but if you see the worldwide, the main issue which comes from this five factor impacts the elderly, and what comes up is the in China, elderly in Japan, in China, those Southeast Asian country, if you go and see that there are many homes and only just one elderly or two elderly, like the couple are living, and the whole city are full of elderly. In Japan, there are some ghost cities, because most of the elderly either have died or one or two left in the whole village or in the city. So that creates a lot of loneliness in them. So for example, this first picture of China, and my son is busy with work, my grandson is in school, who can I chat with? There are no one to chat. There's mirror and they're talking to the mirror. Likewise, in Japan, the situation is really, really concerning. And in India also, we were having, we used to have the extended family or integrated family system where three generations used to live together. But now we have more and more nuclear families, and then elderlies are living in one city, um, and the adults or the children and the grandchildren, they are living in another city. So the job and different kind of other financial structures have changed the family structure of our society, and that is also leading our elderly to feel lonely. And there are the problems with the caretaking. That's why there are some vridhashram or elderly homes or those kind of things are needed. Sometimes it's like the family dynamics is very disturbed and not good relationship, or they feel that the adults are not ready to take the responsibility of their parents or grandparents. Then their need of all those vridhashram or elderly homes. But sometimes there are no one nearby, no adult to take care of the elderly, and they just if they are a couple, then they take care of each other, and one of the couple died, then it's a very, very difficult situation for the remaining one. So these kind of things, issue, you can see that not only their physical health, but how their emotional well-being, their mental health is getting impacted too much by all these things. Just the family structures are changing. And during this COVID pandemic, the this adult age group is 50 to 80. Take this example. Then the worldwide there is a 28% worsening of anxiety or worry. What will happen? Who's there? 19% of worsened sleep, and also 19% of depression or feeling of sadness. And all these happened. There are some stories that during the COVID, the children, the adult children could not come even for the last rites of their parents, and elderly had no one to take care. They were just in the hospitals, or like there are many cases happened when there were no one to take care of the elderly. And so COVID worsened the mental health of the elderly population. They felt more ignored, and lack of warmth, lack of care, and the feeling of anxiety, worrying about their last rites, or depression, or the sadness, all increased. So the main thing, if you want to nail down the problem among elderly care, or among the elderly, the feeling, and once they are alone, the feeling of loneliness uh, at it at its peak. And you see there are many triggers which decline their cognitive and intellectual and many other kinds of activities. Then loneliness has a three-dimensional impact on their health. One is psychiatric. It leads to their mental health and well-being, and then depression, anxiety, and cognitive abilities are impacted. Then loneliness also impact their physical thing. For example, cardiovascular, motor activities, and biochemistry, their neurotransmitter and this and that changes happen. Then behavior issue, physical activity is restricted. They have more dependence on alcohol or other smoking or different other kind of thing. Malnutrition, they don't take care of their food. And then sleep, not able to sleep. So see how loneliness has the three-dimensional impact on the whole life of the elderly population. And here I would take this opportunity to talk more about the loneliness. Loneliness does not mean that a person is living alone. And not only this, loneliness is a subjective feeling. The elderly who are living alone but well connected with their say family members, their children, their relatives, their peers, they won't feel lonely. But even the family full of their relatives and their children and grandchildren, but if there are no connection, no good relationship, then still they feel lonely. So it's a subjective feeling. And we found in variety of researches, especially in the elderly population, that loneliness reduces the life expectancy of by 30%. The risk of dying early is by 30%. If they are feeling chronic loneliness, say for a few years, they're feeling lonely, then chances they will die early. So because the reasons are very clear, that how loneliness impacting their physical behavior and psychiatric, all those health dimensions, and leading them to the darkness of being not cared, not valued, and something like that. So you see, the social isolation and loneliness among older people are harmful because it shortens their life, damage their physical mental health, and reduces their quality of life. They feel themselves restricted, being jailed at some places and not able to do whatever they want because of their physical, mental, financial, or any other social issues. So now we need to talk more about these are the challenges. And for example, see the loneliness can be because I said that connection, the people who are taking care of them are not well connected. Okay, so that is one of the reasons. And then we need to see that what is the way forward, how we can at least save our elderly population from this problem of loneliness, right? Because now we are living in digital world, and it's very convenient, and it cannot solve all the problem, but at least it's convenient that the connectivity, the communication and the conversation can be enhanced using this digital technologies. But again, there is one more thing which comes in the core of moving ahead is human connection. And that today we are going to talk that how human connection using any media, digital or face-to-face or online or offline, any media, but the human connection is necessary step. There is during this COVID, there was one study, and such kind of a study reproduced in different countries where more and more elderly are facing the loneliness problem. What they did, they trained. They oriented some adults, especially the students of 17 to 25 years of age, and then let them call. Okay, they keep it like a layperson delivered empathy oriented phone calls to reduce loneliness, depression, and anxiety. So they did this study in US, especially in the Texas region, where there are many elderly, and they found that there are a very significant decrease. Just they use this, they did this study on for 4 weeks on 240 adults, and they found that these adults were these adults need to call these elderly at a regular period within this 4 week, say for after 2 days or 3 days, something like that. They used to call them, and this was empathy oriented. Okay, so it's not talking about them, but listening to them what the elderlies are saying, telling their problem, experiences, challenges during this COVID time, whatever their experiences, those kind of things. And they found that after 4 weeks of study, they used depression scale, anxiety scale, also the mental health scale, self-reported, these kind of 3 scale they used, and they found that there is a very significant decrease in these 3 things: depression, anxiety, and loneliness, just by the human connection, increased human connection that is empathy oriented. Okay, so from here, and this studies were repeated in many other settings and other countries, and results were surprisingly more or less same. So this study indicated 2 things. One thing, that human connection is like loneliness can be reduced first by human connection, and the second thing is that these kind of disease which leads to like big trouble in the mental illness, this can be easily prevented. Okay, they don't have to go to clinical showing the clinical symptoms and those kind of things, or even hospitalization for those needs, but it can be well prevented if we increase empathy oriented care, if we increase the human connection. So this is a clue which are giving us direction that how best we can use this clue and use this study at different settings of our own places, our own country. Then here, let's take a pause and let's try to discuss what is empathy. So as you see in this study, they used empathy oriented human connections, phone calls. Then if I want to ask our participants, and what do they think, what is empathy, then please share your views. Just in general, what do you think what empathy is? Anyone? Anyone would like to share their views, what exactly empathy is, or their opinion about empathy? Khushi, do you want to say something? Khushi, Rashi, Shubham, or Kiran, Jyot. Anyone would like to say anything? Then please come up. Mansi, anyone would like to say anything about empathy in their view?
Hello, may I?
Hello.
Yes.
Yeah, please go ahead.
Yeah, in a simpler language, it is keeping yourself in others' shoes.
Very good. Very good. Thank you. May I know your name, please?
I'm Minati.
Minati. Okay. Thank you, Minati. Yes, that exactly empathy is. And now you see it's a...
Any other participant? Priya?
Yeah, who wants to share?
Yes, not. Okay.
Kiran, Jyot, Sandeep, anyone would like to come up? Thank you, Minati. Yeah, it is something like that. We will learn more about it.
Yes, Tejasmi.
Yes.
Yeah,
I would
Tejas,
like to say something that,
yes.
ma'am, you have explained all minute things very clearly, and many examples you gave are really applicable to the surrounding I have been living. So this happens. I have seen that the woman who loses her husband uh, is said in one poetry that she loses her center of life, and so she loses everything. She loses her concentration point that for which she has been living for since she knows something that since childhood she's told that you have to live for that person, and when she loses that person, that affects her, that when he is not there, the center of her living is gone,
Yeah.
and so
Yes.
gradually she goes on in the, we can say, gradually she goes down day by day. She thinks that there is none who can take care of mine,
Yeah.
and so I just lost some of the points because of network issues. I'm still in the transit. I have stopped somewhere. So but still I thought I liked your deliberations, and I really thought that yes, such type of awareness needs to be created in amongst I think learned educated people.
Yeah.
And there is, I think that many people, many women themselves have need of having that empathy, because only a woman can understand what a woman feels.
Very true.
So so when she goes to that level, then only she understands what she might have gone through, and so that is too late. So instead, if we learn now that what she might be going through, maybe she might have done something wrong to you, maybe she has done something, and I have seen some young women, young girls who have actually forgiven their parents, who have actually mishandled them. So such type of empathetic situation, empathetic uh, treatment should be given to the elderly persons, and this should be developed, cultivated in the young generation. Thank you so much for giving me
No,
a
thank you so much. No, no, it's very
There
valuable
goes,
addition.
very good. There goes has also retained a deep
Mhm.
feeling within which helps one to. I also want to, I ability, empathy is the ability to deeply care about
Hmm.
the feeling of another person
Yeah,
and sit with um, them some time, loving kindness for whatever they are experiencing. So
Yeah.
there is a researcher called John Gottman
Mhm.
uh, said empathy as a mind made, M-I-N-D, mind,
Mhm.
M-E-L-D, made. So
Mind
it is a
might.
kind mind made. Yes. So, and I call it is a kind of empathy, a level of responsiveness
Mm.
of, of being sit together, talk together, knee
Yeah.
to knee with another person, holding a kind of sacred space, पवित्र, जगह बोलते हैं, So it is a kind of total acceptance and unconditional love. That
Yes.
connotation, I think.
Yeah.
yeah,
That is that.
unconditional. Yes,
Yes.
right.
Yeah. Yeah, that's true. That is what empathy is. Um, so, anyone else would like to add? Otherwise, we'll just go through some more slides and have more deeper discussions related to it. Because let's see empathy as a powerful tool for elderly care, especially. Okay, because we all are going to be like that in just few decades, like 20, 30 years, we are going on the same place. So as ma'am said that sometimes it's too late to understand, right? Sometimes we regret that how we behaved in past with our parents, or why our parents behaved in certain way, or why our in-laws mistreated or misbehaved, whatever is the situation is. Empathy gives you a insight that why it happened. It broadens your understanding and feeling, not only for what you are feeling, but why and how others reacted or behaved in a certain way. Sometimes, for example, you take a that some for example, some mother-in-laws or mothers are very strict about not letting their daughter or daughter-in-law to wear certain clothes or to go out in a certain way, or there are many other restrictions they keep. Then you, once it is on you and you are adult and they are at elderly phase, you feel that they are giving me restriction, and you feel very bad being adult. And but once you have empathy and you try to understand why they are behaving in a certain way, why such kind of behavior are being done by them, or restrictions are there, or liking or dislikings are there, you just go in their life history, just sit with them and try to understand them, and you will have a very clear understanding about their behavior. Maybe their parents trained them in certain way, maybe their in-laws trained them in certain way, maybe the society conditioned them in certain way, and or whatever behavior they got, they are passing it, something like that. You will very clearly understand. And that is a Kiranjit, it's true. It's stepping in the shoe of others. So this is something it increases, strengthens your ability to connect with people, with event, with situation, with experience, with the feeling, whatever you got. For example, I visited my mother just like I was there with her for last 1 month. And I used to call her and talk to her every day that how are you, this, that, just 5 minutes or 7 minutes, something like that every day. But when I went to her, I sit with her, I live with her for 1 month. What I understood was very deep understanding about what situation after my daddy, what all she is going through, what all conditions related to her health, related to her daughter-in-laws, related to her society, her friends, her financial, how these issues are going in her life, and how this kind of things are impacting her health. So and her behavior changed a lot. She becomes sometimes very angry or irritated for something which she never used to. But now staying with her gave me an insight why the behavior is like that. This was my experience, but I am guessing that most of you got some kind of interaction with elderly and try to understand the reason behind the behavior. And that exactly is just stepping into the shoes of others and try to understand their feeling. So as you all mentioned, that sympathy is understanding the feeling of others, or understanding the experience or the reason behind this, right? So let's understand sympathy and empathy is two things which we are going to understand. Sympathy, we quite often understand, oh, you see someone hurt or died or sad or something, then you being sympathetic, you said that I'm so sorry you are in this hole, this problem, you lost your relative or son or husband. That is sympathy. Okay, you're sorry for someone else's condition. But empathy is you're feeling the same feeling. So it's so dark here. See, the one person fell into the hole and the other also. It's so dark here. How are you coping? So you are understanding that how loneliness or how these things, you once you are being there with, like for example, I was being there with my mom, I could understand her loneliness, her isolation, her troubles, her problems, her challenges, her thinking style, her cognitive abilities, all. And then I could see that how she is dealing with her day-to-day challenges, health related, financial related, mental health related, everything. So that created a lot of empathy in me. It broadens my understanding. Then, so we talked about empathy and sympathy, right? Empathy is I feel your pain, I feel your problem. Sympathy is I'm sorry that you are in pain. And there is one more thing which I could see that more and more adults in our society are having that I feel no pain. Sometimes there are many people living in the same family. They see others suffering, but they feel no pain. And this happens especially in this social media, in this very busy world of ours. We don't have time even for our own parents to see their challenges, and that creates this kind of apathy. Even though you want to help, but you feel no pain, and you have like there's no problem. So there are these three things which we need to understand. But within this sympathy, empathy, and apathy, we are focusing on empathy because that is the superpower. So let's see this one. What people think empathy is feeling sorry for someone. But let's broaden our understanding. And empathy actually is sensing other people's emotions, imagining how someone feels, imagine what someone is thinking, mirroring someone's feeling, identify how a person is feeling, understanding another person's feeling, okay, both sides, seeing things from another point of view, understanding is there, really listening to what others have to say, feeling overwhelmed by others' tragedy, okay, not only sorry, but understanding, feeling challenges, thinking, why thinking like that, what is thinking. And this skill is strengthened the different powers in you, in others also. Better ability of negotiation as you are a care provider, or you are working in any scenario where you are going to give treatment or give care to the elderly in family setting, community setting, or hospital setting. You can better negotiate. Sometimes elderly are very rigid about their behavior because they don't trust or they don't have confidence on you, or there can be any other reason. So once you have this empathy feeling, you know how to do this, then you have better power of negotiation. You can collaborate and make patient provider relationship or any kind of therapeutic relationship in a more significant way. Okay, you become the team member of the same problem. So for example, that okay, diet plan should be that, then you collaborate with your own elderly that this should be the diet plan, this should be the medication plan, this should be the physical activity plan, this should be the mental or meditation activity. All things you can collaborate. Then there could be creativity. You can introduce or you can do any kind of care using different kind of creativity. Like you can pursue them to for example, you can pursue your elderly to follow any kind of hobby, maybe some kind of painting or gardening or just walking or anything. Then if you being empathetic, then you can create a safe environment. You can have better emotional connection with your parents, with elderly, with anyone whom you are going to take care. And then you can better understand the need of person whom you are going to take care. Okay, so these, when negotiation, collaboration, creativity, feeling safe, emotional connection, and the needs identification are some strength which will come when you are empathic. So that's why this empathetic call, because they are learning these five things, these six skills used in that study, and that helped them. Then the question is how to practice empathy in our daily life. And Daniel Goleman, he worked on emotional intelligence phenomenally, like very, very comprehensive research on emotional intelligence. And one big part was empathy. He said a prerequisite to empathy is simply paying attention to the person in pain. Whoever you are going to take care, you give your attention to that person. And then today, this empathy word, EMPATHY, I'm using these words, this word with all the letters and one skill, how to practice empathy. Okay, the first is emotions. Okay, emotion, we all know that especially in the elderly age, you see that some elderly become very irritated or very rigid. Sometimes they have, suddenly they feel very angry, or sometimes they feel very low, and even though you try to cheer up, they are not cheering up. because they are in their emotional turmoil, sometimes due to their biological condition, due to their genetic predisposition, due to some environmental factors, due to some health related issue, anything make their emotional level very fluctuating. Okay, so once you are learning empathy, this superpower, this tool, then being mindful about the emotions of the elderly. Okay, so what you are going to see, you are going to learn something about the emotion and how you are going to deal with those emotions. And once you are empathetic with someone, then you will have the understanding of the emotions. You will become mindful of the emotions of others. Once they are sad, telling you something about their sadness, the reason for their sadness, or what are they feeling? Are they feeling low, or maybe ignored, or alone, or anything? Then respect that emotions. Okay, you need to be empathetic to try to understand what they are feeling, why they are feeling, how they are feeling, and what best you can do to handle their emotions. Meaning, most of the time when we communicate with elderly, they start telling their own life story. It's very common among the elderly that they again and again they go back to their own life and tell you a lot of story, because the hidden treasures are there in their experience. They have meaning for telling you, like being adults, sometimes we are in hurry, sometimes we don't have that much of interest in particular topic, or sometimes we don't want to listen. But once you give little attention to the meanings, to the context they want to tell you, the value they want to tell you, it can be sometimes verbal, sometimes non-verbal, sometimes some visual or written. They tell you different types of meaning hidden in their communication. Then being empathetic, we need to respect and try to understand why this person, why my father, why my mother is going back and back again in their past and telling me those stories, because those memories are treasure for them and they want to share their treasures with you. So sometimes maybe they felt empowered, they felt happy or cheered or encouraged, or whatever their emotions are during that time. There is meaning to that. Then validate that meaning in current situation whenever they are telling. So most of the time you see the young generation and the older generation, the main point of conflict is that um, they keep on telling their own stories, right? And the adult generation or younger generation don't want to hear. But let's try to understand that these kind of things, there's always hidden meaning in that, and they want to communicate that meaning, they want to communicate that treasure in different forms. So being empathetic means developing those kind of understanding to find out and value the meaning behind any kind of their communication. The third, EM, and then P, I'm going to talk three things: patience, proximity, and privacy. Okay, patience, because these three things will increase your connectivity as a caregiver, or in the other side also, if you are elderly, then let's see for them also that these three things, patience, proximity, and privacy, this will improve the connectivity and confidence in the relationship, or either it is a therapeutic relationship, or it's a family relationship, or within the spouse themselves. So first thing is patience. Being elderly, sometimes they forget what they are saying. Sometimes they have different kind of yeah, sometimes they have different kind of uh, other things which they want to communicate, but their speed is very slow. So you need to be patient to listen to them, what their story is, then find their meaning with the emotions involved. Then it is all linked, but be patient once they are telling anything about them. The second thing is, if you want to be empathetic, you want to develop that kind of connection, then be in the proximity. Okay, Like, just for example, if you just stay in the same home, just sit with them, not only talk, like you don't have to talk a lot with the person whom you are giving care or anything, but being in their space will give them the feeling of proximity and confidence and connectivity, that someone is here, someone is here to take care of me. It gives them very peace feeling or feeling of safety, that a positive energy, a positive person or a helping hand is there. So the proximity is very important. Many of the elderly during this COVID time, we did a lot of research on elderly and find out the big fear among them is no one is in their proximity, even their own children are not there. And that raised their stress and anxiety level and fear that what happened if I die in this room, no one know. So this kind of things were there. Then proximity is important in elderly care at any point of time, either COVID, not COVID, pre-COVID, post-COVID, any time. Proximity is important. For example, if you're not living with your parents, you're living somewhere else, or the person whom you are giving care to, just keep on visiting, keep on calling. So this kind of emotional proximity should be there. If not possible the physical one, then emotional proximity should be there. Then sharing will improve. And the third thing is privacy. Proximity is good and you need to give proximity, but very mindful. We should be very mindful of their privacy. That if they want to watch something, they want to spend their own time, either elderly couple or alone or anything, we should respect their privacy. Most of the time I saw in many houses, especially in the Indian house, you see that uh, the elderly parents, or they are just if the all rooms are occupied with the young couples or young children, then elderlies are shifted to the living room or so-called drawing room or any common area. It's very common in Indian families. But this kind of thing, and they have no privacy, it's a public space. So those kind of thing is sometimes challenging. Sometimes it's good that they have the community and they have the people, whoever is coming, but sometimes they need their own privacy, and they need their own um, privacy, not only in terms of themselves, but also privacy for their like will or their other financial stuff. They need their bank accounts, their passports, or their any financial transaction or whatever is there. So those kind of privacy should be maintained and um, respected. Then A is awareness and attention. So it's like the state of condition of being aware what's going on, what are their likes and dislikes, what are their health concerns, what is their medicines, and then their memorable days, events, their birthdays, their any such kind of things. Those kind of awareness is very important, and that will come only when you give attention. What are they saying? What are those things? Because once you are aware about something, about someone, about elderly or the people whom you are going to take care, then it's easier for you to make the empathetic connection. So awareness and attention. Then talking. Many times I saw in many families that as soon as elderly start talking, then most of the adults say that be quiet, it's okay, I understand. Not letting them talk. So once you are empathetic, let them deliver whatever, let them talk. So because talking will not only help them to share their emotions and feelings, but also unload whatever is bothering them inside. Because once they will keep storing all their emotions and feeling and like, experience, especially the negative ones, it will give them a lot of stress and anxiety and impacting their mental well-being. So talking is important. Then help. Being empathetic at emotion level, at the communication level, you are working well, but the help and support part in their feeding, in their tying the hair, just cleaning their wardrobe or arranging their stuff, bringing food for them, or any small or the big needs you can help, that will improve your connection and the relationship with the elderly. So that is one part of the empathy. And the why is yearn to learn. Whatever new is coming, whatever people are telling you, whatever new resources you get, both sides. If you want to make this empathetic connection, try to you need to have a year to learn different things, different aspects, different point of views to better understand how best you can take care of elderly. For example, here Yearn to Learn series, we have different things, and the one thing which I would like to share here is the early symptoms of mental health illness. If you see these symptoms, for example, feeling sad for more than 2 weeks, okay, anything more than 2 weeks, these problems, or concentration problem, sleeping problem, paranoia, excessive fear or worries, extreme mood change, suicidal thinking, inability to cope with the stress, anger management issue, excessive use of alcohol or drugs. If you see those things, the people who are elderly, or maybe for in general, for that sake, then these are the symptoms which need to be taken care of. If it is going more than 2 weeks, then older people are reservoir of experience. Give them love, care, and respect to learn these knowledge for your future use, for your future generation. And here I would like to thank all of you to listen to me. And now I would request all the participants to share their view about elderly care and how being empathetic helped them in making connection. It's not that it's something new thing. We all are being empathetic at many point of time in our life with different people. But let's try to discuss your experience when you being empathetic, or when you felt that someone is understanding you, being empathetic to you, and how did you feel? Over to you, Dr. Gautam. Thank you so much.
Thank you. Thank you so much, Dr. Nimisha. It's really like a classroom teaching, very interactive. It's
Thank
like
you.
interactive. Thank you so much.
My
So,
pleasure.
dear participant, please let's have some interaction.
Yeah.
And I can see the chat box. Yes, Kiranjot ji.
Yes, sir.
Yes, please have some interaction. Let's ask some questions. Mansi,
Anyone had any experience with being empathetic, or someone being empathetic with them, then they can share.
yes, Dr. Tejaswini ji. Yes,
I'm hearing, listening to ma'am. I'm trying to validate my empathizing with the elderly person. I have been doing, but I think nowadays being empathetic to all is considered to be stupid. But still, I have been practicing last 10 years. My experience, I'll tell you. There is a non-writer I'm in contact with. He has acted as his foster daughter. So he had stopped going everywhere. He was not going. He was keeping himself at home. And when I visited him, and that on I knew that he's not meeting, I wrote 3 letters to him, and I spoke to him on phone. And he said that, sir, we need you. We need to be here. We just expect you to be there. And next time I called and I heard that he had gone out for meeting. So he started attending at very
Dr. Tejaswini ji, I think because of network issue, we are not able to hear you properly. Yes. Any other?
hello.
Uh,
Anyone else? Go ahead.
yes, Yes, Dr. Tejaswini ji, I think because of network issue, we are not able to hear you properly. Actually, she was narrating some story. Yes, any other participant? Mansi, Kushi, Viniti ji.
Hello.
Yes.
I hope I'm audible.
Yes.
Yeah, to Dr. Nimisha's presentation was excellent. To it,
Thank
I would
you.
like to add, for the elderly population, the role of support group is very important also. Apart from the technology and all, when they cannot connect with their near and dear ones, they can connect with the unknown people and who are having the same interest. I am part of many groups, like some literary groups and all, where from every age, the people connect with each other and they express themselves through writing. And in that writing, there is no judgment. We just listen to each other and there is no valuation. Suppose you take it poetry. You don't see it through the qualitative and things. You just listen the inner voice, what they are trying to say. So that gives them a boost. That is my own experience I'm telling. So that will be also very helpful, I feel. If you cannot do something particularly for somebody, you can make a support group where they can openly come up and tell something. And I want to ask Dr. Nimisha, what are the exercises to improve that empathy in a person? Apart from the holistic one, what we do in workshops and things. What are the so?
Yeah, so like you already mentioned, that if you want to practice empathy with anyone, then first thing being non-judgmental and have patience for the listening. If you are sitting with someone, just listening that person point of view, their perspective, without judging that no, this is not the way, this should not be the thing, that any those kind of advices or your own view, if you can do just this thing, the one and the first thing, that being non-judgmental and listening, if someone can do that, that itself will open a big door for the understanding their others point of view. It will broaden your horizon of understanding and give you deep insights about that. One side, if you see the number 6, but for other person it will be 9, right? So those kind of perspective understanding, and that will itself create a lot of connection, because you are not giving your comments, your advices, you are just listening and have that kind of feeling, that being accepted, that okay, whatever I'm seeing, if I'm seeing something written as 6, maybe this person is looking at different point of view and that person is looking at a 9. If you can have those kind of understanding, it itself will show you your connection, and that is one step of being empathetic, just listening non-judgmentally.
So just one more point. It is not, it
Yes,
is
please.
to being a support, be a counselor or things like this. When you become more empathetic, you really suffer. You get entangled with the people's things and you cannot cut off easily. So what do you suggest? How do you come back to your normal life without being so much entangled with the others?
Right. Yeah, I can completely understand. And this is called transference. It's like once you being empathetic, and then you start feeling the same feelings, right? And it leads, being professional, it leads you towards burnout. And so many, because you are absorbing without intentionally, you are absorbing all that pain and suffering and whatever ups and downs or turmoil, emotional turmoil the other person is facing. So you are absorbing that. In this situation, being professional, especially being counselor or psychologist, this kind of burnout is very common, and it's a very big challenge among this counseling or the coaching or the psychologist groups. Then the one thing which is so far very effective, that you become disengaged. Somehow you need to create your own boundary, emotional boundary, that and it will happen only when you start working on yourself. Okay, so once you start seeing the thing as it is, okay, that the emotional concept related to any kind of situation, like if, for example, if there is some kind of fight in a family, say daughter-in-law or son-in-law mistreated, or the son or daughter mistreated the parents, if you see the situation, okay, there is an emotional factor and also there is situational factor. So being a provider, you need to just understand the emotional turmoil the victim, so-called victim in this situation, are going through, but you again need to stick with just the consequences and the reason behind the situation. The situation, being professional, you stick with the situation factor, leave aside the emotional for rest, for the second counseling session. So if you are taking forward all the emotional factors with you for all the settings, being that emotional connection, that is, you are entangling yourself, then that will create a lot of problem. So this kind of learning of detachment, just attach yourself with the situation, not with the emotion. Only you are sitting, when you are sitting, just keep and trying to being empathetic for that point of view, for that sitting only, but later on just remember the situational, not the emotional point of view. So those kind of things, because this emotion is one-sided emotion, maybe the elderly is feeling some way, but what about the other side? What about the so-called the other generation? If they are doing something, then what is their story? You don't know that. Then being non-biased and try to understand only the situations, not the emotion, can help you to develop this kind of a skill. But this is a well-known problem among the counselors and psychologists. Thank you.
Thank you.
Any other participant?
May I?
Yes, please.
May... Hello?
Yeah, hello.
Can you hear me?
Yes.
Ma'am, you were speaking of loneliness.
Yeah.
So one situation just came up in mind when my father used to say that, you see, when I pass away, it will be difficult for you people to have a great emotional downfall. And it's okay, fine. But it came out to be so true that when he did these things really happened, I found that my mother completely left the idea of being able to live a normal life. She left the idea of being able to walk along, and she got completely like locked up in the bed, and became ultimately, in spite of all kinds of efforts, like we just couldn't make her. I mean, it's not that she never tried. I mean, we forcefully tried to give her company, all kinds of things that are possible, time and whatever, like whatever a human being should do for another human being, not only as a child for a mother. But nevertheless, this idea of having lost someone who is so close to her own very persona, she just, my question is like, we tried in all possible ways that were within our grasp, that however we could, but we cannot, I mean, I cannot become my father, neither can another person be so. So like, one cannot take another person's place in another person's life or heart.
Very true.
But how do you like convince the person? Because we tried in all possible ways. I mean, it just came up in my mind that is there maybe we lost some issue, and it could have been addressed, and that's why I'm asking you the question.
Yeah, thank you, Jayaji. And actually, what I could understand that this problem is grief. you know, the deep sorrow, grief is there within your mom's heart. And once you can process this emotion of grief, maybe because you lost your father also, but as Jayanti ji already mentioned about this, the couple, lost the loss of a spouse, because that was the center of her life. And the elderly generation or the all the previous generation, how attached women were with their husband for their whole life, early marriage, early age marriage, and the whole life they have all the social conditioning, and no other, most of the women have total focus on the husband and family. And suddenly when you lost that center point, then the shock, the grief, the deep pain, that is not only the emotional but also comes into the physical body. That pain is there. And then it happened that most of us could process that deep sorrow, that emotion, but many people could not process the emotion. And all those negative emotions are the sorrow, the sometimes they could be, it can be the anger. Because I could tell you that when my father passed away, then my mother was deeply in pain and sorrow, but she was very angry also with my dead father, that why he left her. So these all the mixed kind of emotions are there. And gradually we try to talk more and more about father, that he used to do this and that, and feeling sorry, share your own pain also with her. We did the same way, and then keep on talking, because sometimes she just kept her mouth shut, no talking at all, nothing. And but we tried to make him alive. We try to talk more and more him. And then whatever emotions comes into, sometimes she started feeling very happy talking about daddy, but sometimes she started feeling like started crying a lot. But that is how it should be, not the shutdown. So once all kind of ups and downs of emotions are processed, being talked, being shared, you share something, let her share something, and then just keep on doing. Some people overcome this kind of grief mode in 1-2 months, but some takes longer period of time. So it varies with different people. But the more you will talk about, let celebrate your daddy's life with your mom at a regular basis. It's not that shutting all his memory will not help. Let you and your other family members celebrate those memory, and let her emotions come out for different situation. You can keep on asking how daddy used to do that or something like that. Then those kind of sharing helps a lot in processing these kind of feeling of sorrow and grief and loss, those emotions.
Can
Thank
I
you,
ask
Jayaji.
you another
Yeah,
question, please?
please.
Another query is arising in my mind, and that is that do you think that stress,
Mhm.
trauma,
Yeah.
can lead to fracture? Is it possible?
uh, is stress and trauma and if not directly, then let's take a step back and try to see that once a person is in a stressful mode or in traumatic that hyper kind of mode, or not, then the attention, the first thing you lose is your attention. For example, when we are in stress, then we either we eat a lot or we do something unknowingly, right?
Can that lead to anybody's femur fracture? Like I had a very complex femur fracture, which is still, this happened in 2019. Uh, my father passed away in 2016. This fracture came down to me in 2019, 2nd January. I mean, that's how I welcomed 2019 in my life. And then ever since that, this fracture is still disturbing me. I mean, I had an operation and the nail is put in there and everything, but still the right leg is not working well. So, I had no physical anomalies as such. All tests were absolutely okay. And still, I mean, I never had met with an accident, neither did I fall down, nothing. Rather, the femur, in spite of the fact that it is the strongest bone of the entire human body, it broke, and it broke in a very, very complicated way. And medical science, you could say, in a sense, failed to explain. So it's one of the doctors in my locality who, after 2 years or so, tried to analyze, and ultimately, after having known whatever things have happened, he said it's although a distant possibility, but it is possible that stress and the entire phases of trauma that you have faced have led to this fracture. That's why I am asking you this question, that whether it is possible or not.
So I thought that because of this stress, you were less attentive and maybe some accident happened. But if that is
No,
not the
no, no,
case,
nothing,
yeah,
nothing like that.
yeah.
Absolutely nothing like that. I mean, I was in full attention. I was leaving for my college. I was holding on to my cycle. I was just about to get up on my cycle and ride it and go to the station. And I was completely in my senses. Nothing went wrong. Nothing happened. Everything was as normal as they were supposed to be every day, like any other day, rather. But yes, the destiny had it in a different way. That's a different issue, right?
Yeah,
I mean, this
but
is
it,
the question.
yeah, we cannot deny the relationship between this and the stress and having such kind of say fracture or something. Maybe there is changes in the neurotransmitter lead to less calcium absorption or something like that, because when you are in a stressful mode, then your cortisol and adrenaline level are very high for a longer period of time.
Medical reports did not say that there were any anomalies. Medical reports were all okay. That is the main thing that is bewildered. I have been to AIMS Delhi. I have been to doctors in my locality, and even big hospitals in Kolkata. But all doctors are not being able to come down to a particular decision that, well, this is the possibility, this is the thing. Nobody could say, because all reports are okay.
Very unique. Yeah, very unique situation. So
And
not sure.
yes, in Delhi AIMS told me that, see, we are not being able to understand what is the root cause behind this, and until we are able to realize, perhaps no medicine or nothing can work also, because we are not being able to understand. It is not giving us any offshoot of like from where this at all came up, because neither do you have any calcium deficiency or osteoporosis or whatever things are lead to such brittle bone diseases. Nothing is there,
Yeah, it's quite surprising.
I don't know. I mean, this is still a big question to me, but because you were saying all these things, that's why it came up to my mind, and that's why I asked you. Anyway, I'm sorry for taking a lot of time of yours, because there are others who must be having something to say. Thank you.
Thank you. Thank you for sharing.
Thank you, Jay. Thank you so much. Minty ji, you want to ask?
I am also sorry again to ask one more question to her. Like
5 to 7 minutes.
Dr. Nimisha, what do you feel? What is the cope-up mechanism for the loneliness? I mean, whether it is gender specific. Like in my observation, I feel that female cope up more than the male. What do you think? And or it is the person specific? You can
no, it's very true. It's very true. If you see in general in our society, then you see women and you see men. Women are more tend to express their feelings, and we always say that कि औरत के पेट में कोई बात नहीं पचती, right? Because they keep on sharing whatever good, bad, whatever is going on in their life. They keep on sharing. So once they keep on sharing, the chances are high they make better connections. But male or the men member of our society, they try to suppress, they try to be very reserved, or like few if you see our past generation, our father or maybe grandfather, you see how quiet those people are. And not like just this young generation where male or female, everyone is talking. But those generation, it was a symbol of their gracefulness, that being quiet. And then you can see the movies where like Amitabh Bachchan and those like those kind of scenario or image was there, where women are like mard ko dard nahi hota, those kind of thing. So they were trained to be quiet, trained to not share the feeling. That's why you see that once in a spouse, once husband die, women feel sad, definitely feel sad, sorrow, pain, but still she survives. But you see, once women died, when the wife died, husband suddenly become like child, because they don't have any support system either, like any physical, emotional. They become more vulnerable. And then the chances, if you see the data, that men uh, men come kill themselves 3 times than women, because of this only reason, because women are more tend to open up, share, make better connection, so they feel less lonely, they are more social. But males are less social, less expressive, less connection, so they feel more lonely when they lose their partner, or if they don't have connection, good connection with their children. Because you see, as a mother, you have better connection with you have better bonding with your children, at least your children, right? Your son or daughter, or even with daughter-in-law, you those kind of relation, you are better connected. But father is something a different figure, where those kind of emotional bonding is there, but expression is very less. So father is still feel separate entity within the family. So loneliness is higher in the male till now. Yeah.
Thank you for clearing
Thank
my
you.
doubt.
No, thank you. That's a very interesting thing to see.
And there is a famous sociologist, Emile Durkheim, who wrote a book called Suicide. And
Mhm.
it is, it is social integration is a factor of something important variable. So those who are in with family, they are less prone to commit suicide. Those who are in alone, less emotional, more rational, they are more prone to suicide. So, and uh, I want to answer one question.
Yes,
Mentee just
please.
asked about loneliness. Just will take 5 minutes or 2 minutes. A kind of 14th century Persian poet, Hafiz, he writes a poem, 4-line poem. It is like that. Uh, or in darkness, the astonishing light of your own being. Means loneliness is also, I'm a kind of humanist psychological point of view, I'm saying, like Arnold Madder, who said loneliness and the neediness is like neediness of our shadow as a part of our healing. So the shadow wants to be cared for, you know. So loneliness means a need to reach out or connect with others like yourself. You know, so it is a situation, or it is a kind of sometimes a conditioning of your self to find something like befriend people sometime and listen their needs for kindness, generosity, and validation as well. So I think loneliness has also a positive dimension also. We need to sometimes, as Arnold Medal, try to talk about. It is a part of healing, part of our. So we need to also try to.
But that is solitude. When you are intentionally you want to keep yourself in solitude, right? That is, but loneliness is where you are not enjoying your solitude, but solitude you are looking for yourself, your inner things. In my point of view, maybe you can
Yes, I was
elaborate
about
more.
to say that. I was about to say that also.
Yeah.
Yes.
Yeah, it has both a way, you can say that, those things.
So
Definitely.
thank you. It was very interactive session. And
Thank
I
you so
think
much.
Ananta Bhai
Thank
is,
you. Thanks, everyone.
Hi.
Always.
thank you. Thank you so much.
Is Professor Anant is here? Yeah. Would he like
Yes.
to?
So, Nimisha, it is a joy to be in your enlightening presence.
Oh, thank you so much. My pleasure.
It is such a deep sense of dedication and felicity with which you cultivate this conversation and your work. So, and it is so important because and we really need a widespread cultural awakening, on these issues. And, OK Mind is devoted to it. We are a small part of this greater challenge that is with us. And I think, and we need a broad-based cultural movement, literature, poetry, songs, which could really awaken our sense of empathy. Yes, empathy is very important, but there is also a dimension of cultivation of empathy.
Yeah.
And the way literature also can play a very important role. Because we have some novels and poems about the condition of the aged, but we need much more. And if we look at historically, for example, the great novel Uncle Tom's Cabin played a very important role in changing our consciousness, and it played a very important role in the anti-slavery movement. Similarly, today, the condition of the aged require that kind of a consciousness transformation. And let us be together in this calling. And again, it is a joy to be in your presence.
My pleasure. Thank you so much.
And, you are back to Hong Kong now?
Yes, I'm in Hong Kong now.
Okay, so you are singing songs to the beautiful sea of Hong Kong.
Yes, it's very beautiful day also. So, like today it was raining the whole day, and then it's a nice weather here.
And many friends, co-present. Minati, as always, has been very engaging in conversation and exploration. Thank you, Minati.
Yeah, thank you. I hope I'm not overlapping sometimes. Like, thank you for giving me the opportunity.
We could not see you, Minati. Would you please put our video for a moment?
Hello. Yeah.
Minati.
Yeah. Thank you, Ananta Bhai.
Thank you so much. So see you tomorrow again.
Yeah.
See you tomorrow.
Thank you.